Picture lying in bed at night, the house completely quiet, and there's a sound that won't quit, a hiss, a buzz, sometimes something closer to a high, thin whistle. You've already been to the doctor, and the answer you got back was some version of, "We don't really know what causes it, you'll just have to live with it." That's frustrating to hear, especially when it's robbing you of sleep. But for a lot of people, that ringing has very little to do with the ear itself, and a lot more to do with what's happening with their blood sugar. Now, tinnitus absolutely can come from years of loud noise exposure, a noisy job, or certain medications, and if that's your history, it matters. But what about the people who've never had any of that? No loud job, nothing unusual in their history, and the ringing is still there every single night? That's the group I want to talk about today. Something I see often in practice is patients who've had every hearing test available, and everything comes back normal, yet the ringing never lets up. That standard hearing test is mostly checking one thing: can you hear a beep at a given pitch? That's it. It doesn't test the frequencies where early damage shows up first, and it doesn't test how well you can pick out speech in a noisy room, so you can walk out with a passing result and still have real hearing loss underneath it. If you haven't already, ask specifically for a high-frequency hearing test and a speech and noise test. Most clinics can run both, they just don't always offer them unless you. So where does the ringing actually come from, if not the ear? Mostly, it comes from the brain. When a particular pitch of hearing gets weaker, the auditory pathway in the brain doesn't just go quiet in that spot. It tends to overcompensate, generating its own activity to fill the gap. That's the ringing you're hearing, not something coming from outside, and not something originating inside the ear canal, but your brain reacting to a loss of input. Blood sugar plays a role here too. Whatever damages the small nerves feeding that part of the ear, loud noise, certain drugs, a virus, chronic high blood sugar can do the same kind of damage, just slower and quieter. Over years, the microscopic blood vessels feeding those nerves start to clog up, and the nerve tissue underneath gets starved. If that sounds familiar to diabetes and the feet, tingling, numbness, it's the same type of nerve, just in a different location. Peripheral nerves run both down to the feet and up into the inner ear. It's often not blood sugar itself that's the main problem, it's insulin, the hormone your body uses to manage that blood sugar. Insulin resistance, when your cells stop responding properly to the insulin your body produces, can sit quietly in the background for 10, 15, 20 years while your blood sugar numbers still look completely normal because your body is compensating by pumping out more and more insulin to force the glucose where it needs to go. That extra insulin is doing damage of its own the whole time, including to those same peripheral nerves. I rarely see someone with unexplained ringing who has perfectly normal numbers across the board when you actually check insulin specifically. Almost never. Anyway, let's talk about the signs worth paying attention to, because this doesn't always show up the same way. A lot of people notice the ringing gets noticeably worse at night, which makes sense once you understand the body is shifting how it uses fuel while you sleep. Some people notice it spikes after a sugary dessert or a couple cups of coffee and quiets down on the days they eat differently. Others describe a fullness or pressure in the ear that comes and goes along with the ringing, almost like an internal pressure change. And a number of people tell me the ringing gets noticeably louder during stressful weeks, then eases up once things calm down. Sound familiar? One sign is different from the rest, and it changes what you should do. The ringing starting suddenly, in just one ear, especially with dizziness or any change in hearing on that side. Zero warning. That's not a wait and see situation. It calls for a same-week visit to a doctor, since it can point to something that moves faster than a blood sugar issue would. Now, why does this matter more after 60 specifically? The blood vessels feeding those inner ear nerves are already naturally less flexible with age, so they have less reserve to absorb damage from blood sugar swings, and insulin resistance becomes far more common past 60, even in people never told they're diabetic or pre-diabetic. The piece I think gets overlooked the most is that chronic ringing disrupts sleep, and poor sleep itself raises blood sugar and insulin resistance the next day, so the two problems end up feeding each other. There's a quieter cost too. Constant noise in your ears, night after night, wears on mood and concentration in a way that's easy to dismiss until it's been going on for months. This isn't something you did to yourself by enjoying a dessert now and then, but if sugar and refined carbs have become a daily habit rather than an occasional one, that's exactly the pattern worth taking a second look at, especially with everything we just covered about insulin. So, what can you actually do about it? The first thing worth doing is getting your fasting insulin checked specifically, not just your blood glucose or your A1C. Plenty of people walk around with a glucose number that looks fine and an insulin number that's quietly elevated, and that second number gets missed constantly because most routine panels don't include it. If your doctor doesn't normally order it, ask for it by name. Beyond that, the dietary piece tends to make the biggest difference. Try swapping the starch at dinner, the rice, the pasta, the bread, for a larger portion of vegetables for about 3 weeks, and keep a simple nightly note of how the ringing feels on a scale of 1 to 10. Most people who'll respond start noticing something within that window, though long-standing cases can take longer, since damage built up over years doesn't reverse overnight. And if you're someone managing diabetes already, particularly if you're on insulin or a medication that can cause low blood sugar, please loop your doctor in before changing your eating pattern or trying any kind of extended fasting window. The same insulin swings that help some people can cause a dangerous drop in others if it's not managed properly. Two nutrients that come up repeatedly in research on nerve-related tinnitus are alpha-lipoic acid and benfotiamine, both with some evidence behind them for supporting nerve tissue. Treat these as something to discuss with your doctor or pharmacist rather than start on your own, since the right dose depends on your kidney function and make along the way matter too. The biggest one is treating this purely as an ear problem and stopping there, getting a hearing aid, maybe white noise at night, and never once checking blood sugar or insulin. That helps with the day-to-day annoyance but doesn't touch the underlying cause. Another common one is expecting results in a day or two and giving up by day 3. This kind of damage built up slowly, so it eases up slowly too, usually over a few weeks. And please don't self-prescribe high doses of any supplement because a bottle's label says so, or because it worked for someone in a comment section online. What works for one person's body chemistry isn't automatically safe for another's. I used to think of tinnitus as almost entirely an ear problem, treated with hearing aids and not much else. I was wrong about that, for a meaningful share of the people I talk to. I keep coming back to this idea that the ear and the rest of the body aren't separate systems. What happens with blood sugar and insulin shows up in places you wouldn't expect, and the ringing is one of them. Before you go, here's the short version. Get your fasting insulin checked, not just your glucose. Ask for a high-frequency hearing test if you haven't had one. Look closely at how much sugar and refined carbohydrate you're eating day to day, and give any changes a few honest weeks before judging whether they're working. Everything in this video is for educational purposes only. Always consult your doctor or healthcare provider before making any changes to your health routine, your medications, or starting any supplement, especially if you're managing diabetes. If this was helpful, give it a thumbs up, drop a comment with your question, and subscribe if you want more like this.